Hello, I'm Dr. Preston Parry. I'm a board certified OBGYN, reproductive endocrinology, and infertility specialist. So I help people have families for a career. We're going to be talking about why, if you're ovulating, you don't get pregnant. And that's a really important question and an important issue because everyone thinks, well, I'm regular. Why hasn't it happened? And there's a lot more to fertility than just whether you ovulate. So if you're wanting to understand on your own behalf or someone else how ovulation influences pregnancy and what else matters, this is the video for you. Does regular ovulation mean I'm fertile? No. Very simple. Because so much can go wrong that has nothing to do with ovulation. Now, if you never release an egg, it's hard to get pregnant. I would agree to that. But it's sort of like saying, hey, my car has tires, therefore it can drive. Well, not if it's missing the engine. There are so many things that go on besides ovulation. Again, got to have good sperm, got to have good eggs, they've got to meet in the tubes, have a place to go in the uterus. Ovulation is just a portion of the eggs. And again, a person can have regular cycles at 48, but not many 48-year-olds get pregnant because the quality of the eggs has taken a meaningful hit, and over 95% are chromosomally abnormal. So I think ovulation, it's great if you are, but at the same time that there's far more to your fertility than whether you release eggs. So first, I think people say, what is normal ovulation? And normal ovulation means you're releasing one egg a month. And most women do. There's some tribes in Africa where about 10% of the time they're releasing two, so they have a higher rate of fraternal twins. But normally, fraternal twins is about 1% of babies, and identical twins is 1%. So most people are ovulating just one egg a month. In fact, everyone thinks they lose one egg per month. By the way, you lose 900, but only one gets big enough to ovulate and release and be receptive to sperm. The fact that people have regular ovulation and they release an egg reliably, that doesn't mean they're necessarily fertile, because a lot goes into fertility beyond the release of an egg. If you really want to make fertility simple, I think everyone should, leave the complex stuff to the exceptions or the specialists. But the simple version is you have to have sperm, you have to have eggs, they've got to meet in the tubes and have a place to go in the uterus. So you could have regular, perfect ovulation. You could be 25, 30, and again, a lot of people get pregnant older than that. And release the eggs reliably, but one of the other variables is going on. The guy is firing blanks. The tubes are blocked. There are meaningful fibroids or adhesions in the uterus that keep things from attaching. So a lot can happen, and it's not just ovulation. Now, why might someone not ovulate? I would say for my practice, not ovulating boils down to really three reasons. PCOS, which is about 90%, professional athletes, which is 9%, or really fit people with a fancy thing called female athlete triad or hypogonadotropic hypogonadism. But again, 90% PCOS, not ovulating, 9% athleticism or being skinny or stressed. And then about 0.9% is from ovarian failure. And then that leaves 0.1% of people who are really complex and a bit different. So what is PCOS? Why don't people ovulate with PCOS? PCOS is a condition where there's a lot of male hormone. And the male hormone prevents other eggs from coming up. And it also sends a signal back to the brain where it then says, I don't need to make more eggs. It lowers your FSH and LH ratios, or particularly the FSH for most people with PCOS. LH can be a bit higher. And that, in fact, leads to the male hormone. And then because they are having that low signal from the brain to the ovaries, people don't make eggs. And in fact, that's why you can look at the ovaries and see all these tiny eggs. There's a lot of little ones that have come up a bit before it responds to the hormone signals from the brain, and then they just stop. So that's PCOS. Next is professional athletes. Professional athletes usually have low levels of FSH and LH. In PCOS, normal FSH, higher LH. Athletes you can see often with normal to low FSH and LH. In fact, if you're anorexic, you can see almost undetectable levels of LH. And so the brain is just not sending the signal to the ovaries to get eggs to grow in that case, and it's a result of stress. In fact, you can see people in ovarian failure, and they do hormone levels, and their FSH levels and LH levels are normal or low. And everyone says, oh, you must have great reserve, when in fact they're an ovarian failure, but their stress or, working out heavily really just shut down the signal from the brain, in spite of normally having the levels that should have gone through the roof because of ovarian failure. Now, with ovarian failure, FSH level is high. So the brain is desperately trying to do anything it can to get eggs to grow, and they don't want to grow. And so the FSH level is very high, and that's a sign that people run out of eggs. And it's not to say they couldn't find a normal egg, but people ovulate their best eggs first. And so if you've kind of run out, the likelihood that there's a good one still in the mix somewhere is a little bit on the lower side. Now, I've talked about other things beyond hormones. Guy doesn't have sperm. The tubes are blocked, and again, this is why I hate HSGs. It's not that they can't be done well, but I would say they can miss a lot of information with 2D x-rays for the uterine anatomy. I think the pain can throw off sometimes whether or not the tubes are open. I like our periscope approach, not that I'm biased, but again, single visit testing that usually doesn't hurt nearly as much as HSG. We have some limited data saying that for sonosalpingography or hycosi or some of these other approaches, I like being gentle for things as well as learning a lot. And seeing the inner uterus with a camera often can give a lot of information others miss. So I would say we have to figure out not just sperm, but tubes and uterus. Other things that throw off, why you don't get pregnant when you should. For lifestyle, smoking, excessive alcohol, excessive weight, those can often slow people down 20, 40%, depending on extremes. But usually if 75% are pregnant in 3 months, and now you've gone a few years, often it wasn't that extra drink you had on Saturdays. Alcohol is how a lot of people get pregnant. Again, I still believe in moderation, still want people to be well, certainly don't want people drinking in pregnancy. But if that just slowed you down a little bit, and you should have been pregnant 8 times, and if you say, hey, with the alcohol, maybe it should have been 5 or 6, sometimes that points to something else going on and you need better evaluation. So what do you do if all your tests come back normal? First, you got to ask, did I get the right testing and did they look at the right things? Always important. And second, you might be in unexplained infertility. But much of our data where a lot of people get pregnant with low-cost, low-tech methods were for unexplained infertility. If you're just saying, hey, we don't know why, but I've got normal odds, that's something you can absolutely work with. By the way, people are saying, well, maybe I'm regular, but let's make sure. Let's track my discharge and look at the spin bar kite. That's sort of that stretchy mucus at the time for the cycle. Here's the thing. Again, now granted, some people can have their mucus off because of surgeries on their cervix or other things. Most of the time, if you're having to go down that road, it means you've been going too long already, and sperm and egg should have met and you should have already been pregnant. I would not try to self-diagnose. Granted, some people are into that, and if you're into that, some people like to rebuild their own cars and change their own oil and things like that. I take it to a mechanic to get my oil changed. I know I could. But the reality is I'm going to just spend too much of my time and be more likely to go the wrong way. That applies to fertility too. I encourage people who really want to get pregnant to see someone who actually knows what they're doing and with a lot of insight, and someone who communicates clearly, and can get you answers as quickly as possible. So a lot of people worry, do they have a luteal phase defect? Where the progesterone levels to support a pregnancy just aren't there, and they need progesterone supplementation. I think that was something that was really popular as a concept 20 years ago, and it's still in all the chat groups and everything like that. But I think as a field, we're moving more away from that concept. Now, there are some people who do need progesterone support. If you had IVF and you got 25 eggs in a month instead of one or two, that's a different balance for things. If you are in borderline ovarian failure and your eggs are breaking down very easily, so you're in your 40s, those are people who often need a little bit of progesterone support. And people who are professional athletes where they have hypogonadotropic hypogonadism, which means the brain isn't sending signal to the ovaries because it's just so quiet from whatever stressors are there, those people often benefit with progesterone. Outside of those three groups, our national guidelines don't really seem to support giving progesterone therapy. So I think a lot of people get a lot of progesterone and it can drive them crazy and it's discharge and it's messy and all these types of things, or the shots hurt. And it doesn't clearly seem to help them. And so I think the luteal phase concept is now more on the back burner. And you can even look at our national guidelines and documents, which really are kind of moving away from this concept. So, and part of it is progesterone's pulsatile. People say, oh, my level was low. It was a 5. You can go from 5 at 5 a.m. to 35 at 6 a.m. So you'll go from low to completely normal in just the period of an hour. It's usually not the level. And in fact, many people don't even bother testing anymore. It's amazing how many women spend tons of time and money and shots, everything, trying to get progesterone levels screened. When I think for the current evidence, my understanding of it is that it really doesn't support that in almost all cases. I think that's some of the core stuff that was on my mind for ovulation. Again, if you have more questions or are wondering about things, post it below, let us know, reach out to us, like, subscribe, share. Know that you're not going through this alone and help others to have answers by talking with them. Support each other, be good to one another, and thank you for watching.